Nice to meet you. My name is Dr. Devora. Um, I just wanted to explain. You come to the right place. Yes, yes, yes. Um, I wanted just to help you out with your pain. And so the first thing that I recommend, I know that your L5S1 is your herniated disc, right? So I would recommend, like, for me personally, like for what I've like treated other patients in the past, I would recommend going to physical therapy. I've had a patient say that she started on the bike, the elliptical, and that really helped her. And yeah, yeah. So exercise is really important because it makes your bones and your muscles stronger. So one thing, I know it's really hard to exercise, and some people don't like exercising. I know it's really hard, but I highly recommend exercising. Pain medicines, they don't really work. I mean, they work, they take away the pain temporarily, but then your pain returns. You just have to keep taking more. And so I don't like to recommend pain medicine because there's so many things you can do with your pain. For example, exercising, eating a healthy diet. I have a book I can recommend to you. It's called, I have a couple books I also want to recommend to you. Actually, one book specifically to help with chronic pain. This is a great book. I highly recommend it. I will show it to you here. It's called, it is called How to Live Well with Chronic Illness, Pain and Pain. Anyways, I'm rereading it again. I think it's a great book to help you feel like that you could relate to something. This book is great for that. And another thing I recommend is you have anxiety, right? Okay, so like deep breathing really helps, in meditation. Um, for pain specifically, exercise. Don't overdo it, but definitely put in some time during the day to exercise, because if you don't exercise, you're just gonna become weaker and weaker and weaker. You don't want that to happen. And I don't recommend pain medicine because it's just a temporary fix. It's a temporary fix to a long-term problem, so I don't recommend it. But I recommend using lavender. And then another great thing is using lidocaine, so that works too. Your pain isn't like too bad, right? Okay. Yeah, so it's like you have like some rough days. Okay. I would say exercise because takes away it will take away your pain. You'll focus on something else and try to find distractions like reading and things to do, because that helps with pain too. Anyways, I was thinking we could do like a little relaxation session before you go home. So I'm gonna put some lavender on you, and we're gonna do some deep breathing. Okay? Do you smell that? It smells great, right? Okay. some of this to use. You can use this in the bath. Now, for nerve pain, exercise still it works. It works. I promise you, it works. Maybe like for nerve pain, use like a ice to get rid of the sensation. And another thing is, baths make the pain worse if you have nerve pain. So I don't recommend taking a bath when you have that burning sensation because it would just make it worse. But if you work out, your muscles will be sore eventually, and you take a bath, you'll feel better after that. So there's like a difference between that. Yeah, so that's what I recommend for now. But I don't recommend shots or any of that. I think you're going to be able to deal with this pain and you're going to be fine. I think, like I said, I have patience. Exercise is key. Exercise, exercise, exercise. It is the best medicine. And a healthy diet. No more, no, what is it, processed food.